Thank you all for the time to come out and talk to you all. My name is DP. I'm the founder of HorusEye AI company. We're going to talk about the opioid health crisis now. The healthcare cost on an annual basis just last year was over $200 billion. So if we take a look at the national health emergency that's being addressed in urban areas, we see small town USA isn't supported. Nearly 1 in 5 US residents live in a rural area. This is a serious health disparity that needs to be addressed. Now, our solution, we're going to develop a web app called Falcon Eye, and it has all the advantages of a web app, that it has the portability, the telehealth compatibility, and it matches up with electronic health records. And it will easily allow prescribing physicians to monitor via their EHR module. So here's how it works. The physician orders monitoring along with their medication in their portal. The interoperability with the EHR vendor exchanges data via a HIPAA-compliant secure channel. So the Falcon Eye web app handles all transactions. For rural patients, telehealth is the most convenient, reimbursable platform to reach them. The app measures eye reflex to determine impairment. The results are returned to the clinician in a report format. The key benefits are it's less burden for the staff and for the patients, easy to schedule, patient convenience, no travel, automated testing. We have more informed care management, increased patient touch, and objective assessment. With CMS reimbursement, they have increased revenue to the practice and more billables. So I've modified the TAM-SAM song since last time. It seems that the numbers changed a little bit. But I think it's important to note on the bottom that additional disease, medication, and health monitoring with Falcon Eye is possible. The examples would be alcohol, marijuana, other medications, but we're addressing opioids today. So this is a business-to-business play. And as you would expect, the cost of goods sold here is very low because this is the cloud-based application. But it's important to note that the Falcon Eye web app runs locally on any mobile device. We envision that it's going to be free for all patients for all time. We're not going to get opioid addicts to pay for anything anyhow. And we have a tiered cost system for our clinicians. As far as the revenue share of 50-50 with the clinics, we figured that that's our projection at this time. So our development path. Here's where we are now. We have filed our USPTO filing. We have award from Google startups for developing on their cloud. We become a Cerner EHR partner. They are the best in class for behavioral health, and that's why we picked them. Plus, they got a good partner program, and okay, yeah, it's free too. We have a proof of concept that's working right now, and I can run the demo later if anybody really wants to get geeked out. So here's where we are. With 50K of funding, we can do subcontract for the HTML portion of the app, and we will have our minimum viable product in the app running. We'll have version 1.0. We're going to go to an alpha site for a treatment center, and we'll start working on the Cerner interoperability. We understand the interface, but we have to get that working separately. We're going to go for additional funding then for version 2 and SBIR, either to NIH or to NSF. We'll add the impairment portion of the test, get an FDA class 1 approval, and we should be good to go. So here's our big chart here. Falcon Eye does all the above, including impairment detection. But right now, the next one down, pupilometer, is done in clinic only, and it doesn't have telehealth capability. Now, Cerner has an app, and it's called Healthy Life. And the Healthy Life portion of it doesn't have impairment, of course. And I have run this app on my phone locally. It is basically a portal that runs on a mobile device that allows you to access your account. It really doesn't have a lot of other functionality in it. Also, Teladoc has been a tremendous success. They are just kicking it in the telehealth field, but they don't have impairment. And we have the other ones down there, but I wanted to explain the inconclusive portion of it. The urine test will show the presence of some opioids, but it doesn't measure impairment. So it's important to know that distinction, I think. So here's where we are, November 2019. We kind of got started in this direction. We've had some other iterations before this, and we pivoted several times. Utility filed, we're pre-revenue, pre-investment, founder funded, broke. It's very simple. And then here's our team. And I wanted to note that Dr. Edmond has just joined the team this year as our clinical development, has been extremely important in developing this presentation, direction of the company, and I really welcome his experience. How are we going to spend 50K? Well, we're going to get a Nevada C Corp formed. We have some subcontracts we need to put out for the version 1.0 and for the graphics, cloud hosting, our basic IP and legal material supply. But it's important to note that this enables the minimum viable product release 1.0. Thank you all very much.